Good afternoon. Thank you all for being here today. I want to personally thank the people of this great state for what you are doing to help combat COVID-19 and ask you, in fact, urge you to continue to stay in the fight. Mississippi continues to see increased cases of COVID-19, increased hospitalizations, and a way too high positivity rate. We see early hints that your efforts are working. That is a sign to keep pressing, to keep working hard. It is not a sign to declare victory. I just want you to know that your increased focus is having an impact. You have the power to save lives. Or, conversely, you have the power to cost lives. Today, I am extending our current executive order for another 2 weeks. And in addition to that, I am adding 8 additional counties to the list of those with mask mandates. Carroll County, Coahoma County, Jones County, Lee County, LaFleur County, Lowndes County, Noxubee County, and Pontotoc County have all now had over 200 cases over a 2-week period, or over 500 cases per 100,000 residents. I want to read them again because this is the most important thing that we will be doing in our executive order. 8 additional counties: Carroll, Coahoma, Jones, Lee, LaFleur, Lowndes, Noxubee, and Pontotoc are the new counties with mask mandates. As a reminder, they join Bolivar, Claiborne, Covington, DeSoto, Forest, Grenada, Harrison, Hines, Humphreys, Jackson, Jefferson, Madison, Panola, Quitman, Rankin, Sharkey, Simpson, Sunflower, Tallahatchie, Tate, Walthall, Washington, Wayne, Calhoun, Holmes, Lamar, Montgomery, Winston, and Yalobusha counties. With these additional 8, that's 37 counties in our state that now are under a mask mandate. As a reminder, we strongly encourage every Mississippian to wear a mask when you go out in public. We tell you that it is best if you wear a mask and maintain social distancing, at least 6 feet away from those that you are around. We can make a difference by doing these little things so that we don't have to shut down parts of our economy again. We are throwing everything that we can at the hospital crisis in our state, and we are going to continue working to ensure the integrity of our healthcare system. I want to underscore this one more time. Even if you do not personally fear coronavirus, the overwhelming of our healthcare systems will affect everybody. If you get in a car wreck, you don't want to be treated in a tent like we saw in other parts of the world, and in fact, like we saw in other parts of the country. You want to get the best possible care. The best way for us to ensure the integrity of our healthcare system is for every single Mississippian to do the little things to help slow the spread of this virus. I've received a large majority of the school reopening plans from districts across our state. I plan to spend a tremendous amount of time this weekend reviewing every one of them. That is my plan, to look at every individual school plan for reopening, and I plan to offer my thoughts on them sometime next week. Going into this weekend, I do want to share a quote from the director of the Centers for Disease Control, Dr. Robert Redfield, someone, by the way, that Mississippians have been in touch with in the days and weeks prior, that I think perfectly puts how I'm trying to approach this. This is from Dr. Redfield of the CDC, and I quote, "It's not the risk of school openings versus public health. It's public health versus public health. And I'm of the point of view that the greater risk to the nation is actually to keep these schools closed. You know, a lot of kids get their mental health services, over 7 million in America, in their school. A lot of people get food and nutrition in their schools. Schools are really important in terms of mandatory reporting, sexual and child abuse. Obviously, the socialization is important. And obviously, for some kids, I think actually a majority of kids, their learning in a face-to-face school is the most effective method of teaching. That said, it has to be done safely, and it has to be done with the confidence of the teachers. It has to be done with the confidence of our parents. But there's been another cost that we've seen, particularly in high schools. We're seeing, sadly, far greater suicides now than we are deaths from COVID-19. We're seeing far greater deaths from drug overdose that are above excesses that we had as background than we are seeing deaths from COVID-19. So this is why I keep coming back for the overall social being of individuals. 2, let's all work together and find out how we can find common ground to get these schools open in a way that people are comfortable, that they are safe. That was a quote from Dr. Redfield of the CDC. What you should glean from that, and certainly what I do, is that these are exceptionally complicated issues. The reopening of schools in this environment is a major challenge. I get that. I understand that. But to those individuals in our state who say the public health of the spread of the coronavirus is the only risk at play when making a decision about our schools, are ignoring so many other risks that exist out there. Dr. Dobbs and I had a long conversation this morning about trying to find the right answer to mitigating as much risk as possible in the reopening of our schools. We know that we are not going to mitigate 100% of the risk on either side of this equation. And so what we must do is look for innovative ways to reach what we all believe is the right outcome. And the right outcome long term for kids is that they are in an environment that is loving and that produces and provides an educational opportunity. When I think about some districts, and I hope that this is this distinct minority, that would submit to you that they should close for the entirety of the 2020-2021 year, or that hopefully they can do distance learning that is totally different than the distance learning that they did in the spring. What I would say to you is if you take a first grader or a second grader or a third grader or a fourth grader that was already struggling to keep up, and you take them out of the classroom for months and months and months and months, quite frankly, that could have not only an impact this year and next, that could have an impact on that first or second grader's life for the rest of their lives, because they may never catch up. Let's think about this in terms that I like to think about, and that's in terms of mathematics. And I'm going to use round numbers here, but let's just assume for a second that we have 450,000 kids in our schools. That's approximately 35 to 40,000 kids per grade. Let's assume that of those 35,000 kids, that roughly 2/3 of them are doing just fine. They'd probably do just fine in an environment in which they were being taught in the classroom, and those 2/3 would probably be doing just fine if they had to do distance learning. So that leaves somewhere in the neighborhood of 10 to 13,000 kids across the state of Mississippi per grade that really need that instructional help, that really need that extra hand that so many great teachers provide. Let's just assume for a second, rather than 10 to 13,000, let's just call it 11,000 students per grade. Kindergarten through 5th grade, if we go with that 11,000 kid number, that's 66,000 kids in our state. That if we just said, okay, we're just going to shut down schools because we have the spread of this virus and it does increase certain risk, then that'd be between 65 and 70,000 kids, maybe even 80,000 kids in our state that could go 6 months, some 11 months, 12 months without instruction. Mississippi cannot afford, and those individual kids definitely cannot afford, for 65 to 70,000 of our kids to get so far behind that they can never catch up. It's just not realistic. The risk associated with that for those individuals for the rest of their life has to be weighed against the very real risk of the spread of the virus. We know that. We are dealing in a time unlike, I believe, what anyone else in this country for the last 100 years has had to deal with. We are trying to find the right answer to mitigate and minimize risk on both sides of the equation. There is no answer when it comes to schools which says you can assume risk on this side, assume no risk on this side, and so the question should be easy to answer. There is no such solution here. What there is an opportunity to recognize that there are risks to be mitigated no matter the decision. Let's review what I hope to find are innovative ideas being implemented in certain schools across the state. Let's figure out a way to exercise best practices so that we can mitigate and minimize the risks amongst kids and teachers and communities of the spread of the virus, while at the same time minimize and mitigate to the extent possible the very real risk of teen suicide, of things such as kids being malnutrition because of the lack of those school lunch program, things such as the mandatory risk that come with mental health services or the lack thereof if kids are not in school, as well as the very real risk that are sometimes mitigated through mandatory reporting of child abuse and other sexual abuse by kids while in school. So these are not easy answers. There is no right answer. There is a desire by me and many of my fellow governors around the country to try to find the right balance. And ultimately, that's what we've got to find, is what is the right balance to do what's best for our kids across Mississippi. I'm committed not only to the 2/3 of kids that might be able to be okay, I'm also committed to make sure that 1/3 of our kids who might otherwise struggle and maybe never overcome it, that they have an opportunity for success in life. I'm committed to both groups, and I'm going to do everything in my power to make sure that we protect them and mitigate and minimize risk to the fullest extent of my authority. With that, I'm going to ask Dr. Byers to give us an update on today's numbers.
Thank you, Governor. Well, you know, today we're reporting it's still bad out there, guys. We're still seeing transmission. We're reporting an additional 1,775 cases identified today, and an additional 48 deaths. Now, many of those deaths are from death certificate data, but they are deaths nonetheless that are due to COVID. We're still seeing a significant impact in our most vulnerable populations. We're still seeing a significant impact on our long-term care settings. We currently have over 200 outbreaks in our long-term care settings. That's an astounding impact. We've dealt with outbreaks of respiratory viral illness in nursing homes and other settings before during flu seasons, but not to this extent. And so we still need to continue to do those measures to protect those folks in those most vulnerable settings. You know, we're seeing a lot of transmission within nuclear family groups and a lot of transmission that's occurring just from, you know, interacting with that family member that you don't see very often, or interacting with folks and family members at gatherings like funerals. And so we're at a point now, guys, and we've said this before, where we need to act as if every single person that we come in contact with has COVID. And we need to act as if we have COVID and do those measures we need to do to protect us from transmitting it to other folks. You know, we know there's a lot of asymptomatic people out there that can transmit the infection. We know that there are people out there who may have minimal symptoms and never even recognize that they're infected. Wear a mask. This does prevent transmission significantly. In addition, we have 972 confirmed cases that are currently hospitalized, and an additional 273 of those cases that are suspected COVID-19 positive. Even though we've seen some bit of leveling in the amount of hospitalizations, that's still astoundingly high. We have, if you look at the Jackson area right now, when I looked at the data before I left, 4 ICU beds available. And so not only does that have an impact on the people who are going in for COVID-related illness, but as Governor said, also those people who need ICU and hospital care for any number of medical reasons. Just to kind of think about where we are overall, currently in Mississippi, we have over 57,000 confirmed cases that we've reported in the state, confirmed and probable cases, and over 1,600 deaths in the state. Thank you, Governor.
Thank you very much, Dr. Byers. It's good to have you back. Dr. Dobbs is got a previous engagement today, and so he'll be back the next time we get together. At this time, I'm going to turn it over to Director Michelle for his emergency management update.
Thank you, Governor. Good afternoon, everyone. Commensurate with the increase in cases, we still are heavily engaged in our PPE deliveries across the state. As of tomorrow, we will have made 146 deliveries to our Tier 1 facilities to ensure that they maintain the appropriate level of PPE. And in addition, we continue to run hotshot missions to those places that have flare-ups and immediate needs, continue to be on the road. Our National Guardsmen doing an outstanding job continuing to support this mission. They have to date broken over 200,000 miles of running up and down our Mississippi state highways, getting this PPE out where it needs to be. So they've done a Herculean effort in supporting this, and very proud and very thankful to have them as part of this mission. As promised, we have successfully completed the beta test on our COVID Emergency Relief Fund, the CARES Act track that we've been talking about over the course of the last 2 weeks. We have that ready to go. It will launch live on Monday, as promised, August the 3rd at 9 a.m. In conjunction with that will be our call center, will be manned by 6 personnel from 9 a.m. until 3 p.m. Monday through Friday. We will monitor that. If we need to extend or modify those hours either throughout the week or on the weekend, then we will do that. This is a flyer that basically will go out. I am not going to publicize the phone number today because I don't want, through miscommunication, people start calling a deadline and then create additional frustration. We will message the phone number for that throughout the weekend. I will message it again very heavily should we have a press conference on Friday, but we will push this information out. As always, my website, msema.org, has all the information, very good tutorials, step-by-step, of what is available, what is acceptable under public assistance, and what is eligible under the CARES Act funding. Great tutorials there, and again, the call center will be open as of Monday morning, 9 o'clock. Real quick tropical update. Tropical storm Isaias. Yes, I studied that to make sure that I pronounced it. I still don't know that I got it right. But Tropical Storm Isaias continues to move on a northwesterly course across over Puerto Rico, vicinity of Puerto Rico now. And currently, the projected track would take it to the eastern side of Florida, then out into the Atlantic. But I will tell you, the only thing that has been consistent thus far about this storm is inconsistency. So we'll continue to watch it. It currently does not pose a threat. But I will tell you, and I will tell all Mississippians, particularly those who are on the along the Gulf Coast, this time of year, a storm that gets this close, it could very easily get into the Gulf, and if it does, then it's anybody's game. So continue to watch this storm closely, and we'll continue to keep you updated. And finally, we did get another tropical wave that came off the west coast of Africa. We'll be watching it over the next week or so to see what it does. But as always, we must be vigilant in addition to everything else that we're doing here in Mississippi. Sir, that concludes my update today, sir.
Thank you, Director Michelle, and a special thank you to your entire team, along with the Health Department, for the work that you're doing. I am very, very proud of the work that's being done by numerous state agencies. The fact is that there is a significant amount of work that has to be done, and the administration of so many different CARES Act programs has certainly led to additional work for everyone. And I want to thank you and your team, the Health Department, and all of state government for stepping up to the plate and doing just a little bit extra to help your fellow Mississippians. With that, I'm going to open the floor to questions. Yes, sir.
This question for Mr. Doctor. We have seen a spike in long-term care, and I think we had, as of today, we had, I think, 203 outbreaks. So what are you guys doing to prevent that?
Well, you know, it's difficult in congregate settings and residential settings, and we know that, you know, once a case is identified among residents, there's a potential that there's already transmission that's occurred. One of the things that we're doing is we're helping nursing homes and other long-term care settings, when cases are identified, to provide testing support to help identify those cases that you didn't know about yet. Those individuals who may have been those residents who haven't exhibited symptoms yet, or even the employees that haven't exhibited symptoms yet, so that we can get those residents in isolation, that we can utilize the right infection control to prevent further transmission, and so that we can get any employees that we identify who are positive excluded from that setting. This is a highly vulnerable population, and we know that the transmission dynamics within any sort of congregate setting where you have individuals who are especially vulnerable, that transmission can occur rapidly. So one of the things that we want to do is identify those cases as quickly as we can so that we can go ahead and put in place those measures to try to prevent further transmission down the line.
Governor, I believe that we talked about it some last week, but I'd be interested to hear from both you and Dr. Byers. The high positivity rate, I know that Mississippi has the highest positivity rate in the country, but that combined with the increasing number of cases seems to indicate that we're not catching all the folks before they get sick. If we were able to cast a wider net, could we do things like potentially drive down hospitalizations before these folks who are maybe asymptomatic start spreading it on to those in the more vulnerable population?
Right. Well, one of the things I would say is it is not clear to me, based upon the data that we are reviewing, that we actually have the highest test positivity rate in the nation. What I will tell you is we have a test positivity rate that is way too high. And if you look at, and there's no arguing that point, if you look at the data that we receive on a weekly basis from the White House Coronavirus Task Force, which actually I think is probably the best data you can possibly use, because while they're not getting 100% of all cases, they're getting a very wide varying sample of about 46% of all cases, and they're being uploaded on a normal basis. And so what they said our test positivity rate was last week was about 15.4% versus the HHS regional average, which includes Texas and Florida, by the way, to be fair, of about 14.5%. So our overall positivity rate was higher than the southeastern region, and obviously the southeastern region is going to be, at least at this point, the hottest of the hot spots in America right now, if you include the Southwest as well, with Arizona, California, and Oregon. And so you've heard me say this numerous times, and I'll say it again. To me personally, the test positivity rate is a data point worth considering. But I would also tell you that if I wanted to play with the data, I can go reduce our test positivity rate. I can go randomly select people to test in a county where there have been very few reported cases, and I can drive down the test positivity rate. Of course, that doesn't do anybody any good to do that. But my view is test positivity rate is something that has to be viewed in context of all the other data. Within all of the data that we look at, the 1,775 cases that are reported today is certainly a number that is, if not the highest, certainly one of the 3 highest case counts in the entirety of this COVID crisis that began early this year. So we're well 6 months into it. And so what I would tell you is we are in the middle of the fight. We are in the middle of the worst time that we have had to deal with, and we must be diligent about where we find ourselves and do everything we can to slow down transmission within our communities. We have 204 cases, for instance, in long-term care facilities. The reason we have 204 cases in long-term care facilities, it's a direct result because we have transmission in our communities. We tested and the health department, the National Guard did yeoman's work. The last 2 weeks of May, we tested every single resident and every single employee in a long-term care facility. We got the total number of outbreaks down to, I believe it was in the mid-70s. Well, now it's up at 203. The reason that occurred is not because the virus manifested itself within the long-term care facilities. It's because transmission occurred in the community. As I have said for weeks, maybe it was a 22-year-old who did whatever he or she wanted to do, got sick, probably was asymptomatic, didn't have a problem. They went home and stayed with their mom. They gave the virus to their mom or their dad who works in that long-term care facility. Unbeknown to them, they took the virus into the long-term care facility. But it was because of transmission in the community that we now have these issues within our long-term care facilities. The thing that really concerns me, and I think we're going to see this occur, if you look at the total number of deaths, and you look at those that are in long-term care facilities versus those that are not, the first 2 months or so, certainly the first 7 or 8 weeks, after we had our first death in Mississippi, the majority of the cases, the majority of the deaths, by a large number, were not long-term care facility deaths. They were deaths that were occurring by people who were not in nursing homes, were not in long-term care facilities. Well, then we went through a period there in May, and then early June, where a very high percentage of our total deaths were in long-term care facilities because transmission occurred in the community, deaths occurred. That transmission that occurred in the community was then taken into our long-term care facilities, and more people in those facilities passed away. Well, then we got that under control through testing and other very strong methods of dealing with it. And now we find ourselves where, because of lots of events that occurred in late May, you had significant transmission that occurred in June. Right now, we're back to a point where if you look at the red and blue chart, which I look at every single day, it's a lot more blue than it is red. That means a lot more of our deaths right now are occurring out in society, not in long-term care facilities. My fear, and I'm afraid it's going to be borne out, is that if we look over the next 2 to 3 to 4 to 6 weeks, we'll probably start seeing more and more deaths coming from long-term care facilities. And so I think our fatality numbers are going to go up, and that is horrible, it's horrific, it's tragic, but I'm afraid that's what's going to happen. And so, and then the percentage of overall deaths will lean and edge more towards those long-term care facilities and that's terribly unfortunate. We went through a 6-week period there where deaths were on the decline. That is no longer the case. Unfortunately, fatalities are on the rise, or at least have been on the rise over a period of time, and most of those fatalities are coming from those in non-long-term care settings. I don't know if you wanted to address that or not, Dr. Byers.
Yeah, absolutely. And you know, as far as the test positivity rate, you know, we've seen some fluctuations with that. And we know that not only are we having some difficulties with providers reporting positives to us, and we certainly encourage all clinicians, all physicians who are doing any sort of testing for COVID to please report at a minimum those positives. But we know that there is likely that we're not getting all the negatives as well. And you know, that can certainly affect that positivity rate. But it is a disturbing trend. It's certainly a disturbing indicator, but it's not the only one. And we continue to see our cases rise and our deaths rise. As the governor said, we certainly are starting to see more of a mix of deaths that are occurring outside of long-term care facilities. What I can tell you is even in those deaths, those are occurring among high-risk individuals who have multiple comorbidities, chronic underlying medical problems that certainly put them at higher risk. And you know, it hadn't been too long ago that we had a death in a young individual, 20-year-old, and this was an individual who also had underlying medical problems, and it's tragic, and we feel every one of those, I have to tell you. You know, as far as asymptomatic spread, you know, we're looking at some different initiatives now that we hope to put in place in the next coming weeks to be able to identify more in community settings those individuals who may be asymptomatic who are transmitting it. But you know, there's a couple of things that we ask physicians to do. When you see somebody, when you test somebody, if they're a contact, if they are somebody who's symptomatic, please get them isolated. And we've provided them with some information to give to their patients to help facilitate this, because we don't want to miss opportunities. You know, by the time that test is back positive several days later and it's reported to the Department of Health, we've missed a window where we could potentially have transmission. And as far as the asymptomatic transmission, that's really why we've all got to really take the position that at any point we could have COVID and we could potentially spread it to other folks. And if we're doing those things like we're doing here, staying 6 feet away, we're wearing our masks consistently, that can really have a big impact. But we've all got to really take that responsibility.
And just one final statement on that. I don't want to belittle the fact that our test positivity rate is way too high, whether it's 16% or 26%. We had it down to between 6 and 7% with a low number of tests back in late May. And we want it below 5%. So it is, whether it's 3.5x or 5x more than it needs to be, it is way higher than it needs to be. And we've got to, and it's because transmission is occurring, and we've got to do everything we can to slow that down. Yes, sir.
Dr. Byers, you know, you mentioned earlier that we're seeing like kind of leveling in hospitalizations with coronavirus. Since we've seen such a high increase over the past 2 weeks of like people with like just new cases, do you expect to see any increased hospitalizations in the coming weeks?
It's certainly possible. And even though we've seen some leveling in those numbers, that's not good. We're still very high in those numbers of hospitalization. We saw this before when we started having the increase in cases back in mid-June, that it wasn't long after that we started to see some increase in hospitalizations and the increase in deaths. It's certainly quite possible if we continue to go up that we'll see more pressure on that hospital system.
Do you know why we might be seeing that level of leveling right now?
Say again?
Do you know, have any ideas about why we're seeing that leveling in hospitalizations right now?
Well, you know, we don't really know. We know that we're working very hard with hospitals to maintain capacity. We're working very hard with hospitals to have those convalescent care units when an individual no longer needs that higher level of care that we can offload those hospitals and maintain that capacity within the hospital setting for the sickest individuals. We're going to see some fluctuations, and if you look at our numbers now, you're seeing some fluctuations up and down. Just because it's level today doesn't mean it's not going to be or potentially be up at a later point.
Thank you, Renee, and I'd like to request a follow-up, if I may, if you don't mind. Governor, I'm sure you're aware of a major outbreak down here in South Mississippi at the George County Correctional Facility. Total cases, 229, that's inmates and staff. That's over half of the inmates in the facility. The warden there is saying he's not going to take any new prisoners. Could I get you to comment on that worst case scenario for spread, inmates in confined spaces with staff moving in and out?
Yeah, thank you for that question, and you're right. At the George County Correctional Facility, it has a maximum of 333 state inmates, and it is my understanding that the most recent data that I have actually has 233 positive confirmed cases. As you know, we have tested 1,026 total inmates and MDOC staff since the beginning. As soon as we learned of significant, what appeared to be multiple cases at that particular facility, thanks to the help of many, we did go in and test every single inmate in the facility, and it appears that somewhere in the neighborhood of between 60 and 70% of those state inmates tested positive.
Okay, my follow-up to you, Governor. Considering, again, that perfect storm of staff and inmates.
A lot of Americans, a lot of Mississippians are going to suddenly have a decrease in income. Are you doing anything to possibly prevent evictions as, you know, potentially tens of thousands of Mississippians see reductions in their weekly income?
Yeah, so we were very quick and very early to limit evictions from the state level. To begin with, when this coronavirus occurred, the federal government also passed legislation to limit evictions. We are monitoring what's happening on Capitol Hill very, very closely. We have been warning our fellow Mississippians for a long time that if you have the opportunity to get your job back, we strongly suggest that you do so, because that extra $600 of pandemic unemployment assistance was going to run out. And I believe that we are certainly at the point at the end of that rainbow. And while that's unfortunate for a lot of Mississippians, and I'm hopeful that the Congress is going to come up with a plan at some point, but I do not believe that the plan is going to be an extension of the additional $600 per week for a long period of time. I think that there are two options at this point, and this could certainly change. But one option is that really there are three. One of which is everything, all of the additional assistance goes away, and anyone on unemployment assistance in Mississippi goes to a maximum of $235 per week. The second possible outcome here is that the two sides in Washington agree to a temporary extension to give them more time to negotiate. And then the third option, or third possible outcome, is that the Congress agrees to a plan to take that additional weekly pandemic unemployment assistance from the plus $600 to maybe a plus $200 or plus $250, which is probably in the long term the most likely outcome. And by long term, I mean really intermediate term of the next 3 to 4 months, that there is some extension of the additional assistance, but not at the level of $600 a week.
Sam with the Mississippi Center for Investigative Reporting has a question.
Thank you, Governor. Since the legislature voted in 2013 against expanding Medicaid, 5 rural hospitals have closed and 2/3 of the remaining rural hospitals are losing money. Are you concerned about rural hospitals closing in Mississippi? And if so, do you think that hospitals would have been better off financially to face this pandemic if Medicaid had been expanded in the state?
Well, thank you for the question. I am certainly very concerned about access to health care in rural parts of Mississippi. I think it's critically important that we focus our conversations around not only affordability but also accessibility of health care in rural communities throughout Mississippi. I do not believe that Medicaid expansion was the right thing for Mississippi to do in 2011, 12, 13, 14, 15, 16, 17, 18, 19, and I do not believe that Medicaid expansion is the right approach for Mississippi in 2020 either. I think that, I think it's not unlike the previous question in which the question was asked, should we, because of the pandemic, should we let inmates who are not eligible for parole or not eligible to be let out, should we let them out? To me, it's the same approach as because of the pandemic, should we expand Medicaid? And there are those who believe in these more liberal public policy positions that take the position that former Obama Chief of Staff Rahm Emanuel took. This has been said by many other people before him, but you'll remember that Rahm Emanuel, who worked for President Obama, said that the liberals in Congress should never let a crisis go to waste. And I think with respect to many of these liberal policy positions, that's what a lot of people want us to do, is to use this crisis to enact very liberal public policies, and I don't think that's a very smart thing to do right now. Oh, I'm sorry. Yes, sir.
Dr. Dobbs, how and can you, as one of the leading state doctors on this issue, convince parents it's safe to send students back to school? A reminder that it's not only second and third graders going back to school, it's also middle schoolers, high schoolers, different age ranges. How is it okay, or is it safe to send hundreds of people back under one roof?
Well, thank you for the compliment. I'm not Dr. Dobbs, but he's the smart one in the duo. It's a challenge. What we are doing to work with schools is determine the best practices that can be put in place to try to limit transmission within the school setting. What to do when a case is identified, what to do when there's a potential outbreak in a group setting, and we're devoting additional resources to be able to help schools with many of these decisions, including when there might be a school dismissal. We know from looking at much of the data and from looking at what we've seen in our child care settings so far this year is that the impact on the younger kids may be different than what we would expect to see with middle schoolers and high schoolers, where there is a potential for transmission. There's risk with anything, and there can be risk when you get individuals together in any sort of setting. What our goal is to provide the schools, and like I said, we're working closely with schools, to put in place those measures to mitigate the risk as best we can, with the understanding of the needed balance for and the importance of kids to continue to receive education and to be able to continue to attend school.
And a quick follow-up. Governor, many of parents are asking, what's your plan, if there is one, to increase testing around schools, perhaps asking the federal government for more resources so you can accomplish that? Is there anything that you've been working on as far as testing and targeting school-aged children?
Yeah, so we've had numerous conversations regarding testing of various communities, testing specifically in long-term care facilities, testing specifically potentially for teachers, and those are conversations that are ongoing, and that as we review the school opening plans and make recommendations next week, I would anticipate that certainly being a part of it. Yes, ma'am.
Hi, how are all y'all doing? Just had a quick question about the plans that you're receiving from all the schools. So obviously those plans will be submitted, like supposed to be submitted by tomorrow. And earlier in the week, you were saying that you weren't impressed with some of those plans. Is that still the case? And why aren't you impressed with the ones that you were not happy with? And if you aren't pleased with the plans, what will happen? And I have a follow-up question.
Sure. What I would say is there have been those districts that have said that they're going to go, for instance, to distance learning for the entirety of the 2020-2021 school year. That is not a plan that I am particularly impressed with. There have been districts that have said we want to do in-person learning, but we think we want to take a break, 2 or 3 more weeks to kind of get to Labor Day and take a look at it. That seems like a reasoned approach. And then there are those who have said we are going to go ahead and open with the following safety precautions in place that certainly have followed, maybe not exactly, but certainly followed the guidelines as set forth by the State Department of Health and the CDC. And so there's a wide variety of them, and I'm not prepared at this point to talk about every single one of them, but I do think that there are well thought out, well reasoned plans, and then there are those that are, shall we say, much less so. And as we look through it, we will make some final determinations over the next week or so.
Okay, and following up on your response to that, so if you aren't happy with what they have outlined, would you guys step in and make your own changes? And then also, I know a lot of people are talking about you wanting to enforce masks inside the schools. Do you anticipate stepping in and making that a requirement?
Well, and I think your initial question on the follow-up is really a very important point. So we in Mississippi have long-standing state statutes which give broad authority to our school districts. We generally believe in allowing for local decisions to be made when it comes to our local schools. Typically, I am a strong proponent of that. We are in very unusual times now, and so we are certainly looking at what authority we have from a legal standpoint, but also what authority do we have in terms of encouraging those districts that maybe have gone a little bit too far and want to get a little too wide open, while at the same time encouraging those who want to close a little too tight and try to find some common ground that makes sense. I do look. I want everybody in our state to understand something. I completely sympathize with our local school leaders that are having to make decisions unlike any decision they've ever had to make in their life. And I've been dealing with coronavirus for the entirety of 7 months now. And there are a lot of decisions that are brought before me that I sometimes wonder if I have the credentials to actually make those decisions. And I know that every single school administrator in this state is thinking the exact same thing. Because look, the reality is the vast majority of Mississippians want to do the right thing. It's hard to know exactly what the right thing is. But my point to everyone is this: there are risks associated with every single possible decision on our menu. We are talking about making the decision that has the least negative impact and the most positive impact on the most possible number of kids in Mississippi. And so we're going to try to get to a point where we can get as many kids as we can back in the classroom in a safe, responsible way so that they can learn, so that we can get back to showing the world what it means after conservative education reforms to see significant educational attainment improvements in our state. That's where we were in November of 2019, and that's where we will get back to. We just got to find a safe, responsible way to do it. Yes.
Dr. Dawkins, with the gazebo, is that
Thank you, Renee. Thank you, Governor. Governor, I know that you're not a big fan of reiteration of questions, and I don't want to, I'm not a big fan of asking reiteration of questions. But I've got two questions for you and Dr. Byers if you want to chime in. The first question, Governor, since you've answered all of these questions about education in schools, do you have in your mind, or have you or Dr. Byers or the health department come up with what you're thought of a safe timeline? You know, for instance, most schools will be opening next week. I don't necessarily think that's 100% comfortable in y'all's mind, but that's what's pledged to happen. And the second question, Governor, would be, is there any way or any thought process of calling a special session for the School Recognition Act to follow up with that? So thank you, Governor.
Yeah, so the second question, the answer is yes. There is the potential for a special session to be called with respect to the school recognition program. It is currently July 30th. The MAEP money that is the largest chunk of the education budget has been transferred to the individual school districts. And so we plan to work with the legislative leaders, with the Lieutenant Governor, with the Speaker of the House, to determine not only a potential outcome of a special session, but what should be included in it, as well as time frame. We are not pressed on time. When you look at our numbers of COVID-19 positive cases, there were an awful lot of community spread that occurred because of the outbreak that occurred at the Capitol. And it occurred in every community across our state, and so we do not want to bring the legislature back for a special session until I am convinced it is absolutely safe to do so. Your first question, I do believe that there are schools that have plans in place where they can mitigate risk and minimize risk and bring kids back to school as early as the second week in August. I think that that's what a number of the districts are looking to do. Not all of them, in fact, a large number are not. But I do think if you implement proper mitigation rules, ensure social distancing, ensure the kids are wearing masks, ensure that the teachers are teaching in a way that have either face shields or masks, that there are ways to minimize risk, mitigate risk. And that is true a week from now. It's also true a month and a half from now. All of that with the obvious caveat that we are at a time where we have more cases now than we have, although you do start seeing a slight turnover in 7-day numbers, but we're a long way from being out of the woods.
Governor, we don't know what ultimately is going to happen, of course, in partisan Washington, D.C., but we do know that tomorrow the $600 federal unemployment enhancement will expire, affecting thousands of Mississippi families. But closer to home, a few weeks ago you said 300, maybe even 500 million was needed for the state unemployment insurance trust fund. Legislature put 182 million in CARES Act fund. Lawmakers have told me that was more than enough. In your mind, is the unemployment trust adequately funded?
No. But I will caveat that by saying, and I want to thank, I believe it was Senator Hobson's bill, but I want to thank the legislature who did, to their credit, fund that at $181 million. They also said any CARES Act money that was not spent in the various programs that we set up would then go to the trust fund. But the $181 million is not going to be an adequate number. At its peak, and we're not that much below the peak, we were spending approximately $20 million a week in state unemployment benefits. $20 million a week, that $180 million would go for 9 weeks. We are far more than 9 weeks into the the significant uptick in cases. And so what I would tell you is there is going to have to be additional money put into the trust fund, either through CARES Act money that is left over, and there's going to be CARES Act money that is left over, by the way. And so there will be the potential for a significant additional bump in the fund once we get through October and November. Yes, sir.
The U.S. Bureau of Economic Analysis released that the GDP of the United States has dropped about 32.9%. What is your response to that, and what do you think that's going to mean for Mississippi, as we still have a bunch of people that are unemployed, and we're also facing people that aren't going out, aren't leaving their homes as much to spend money?
Well, there's no question that when you look at the U.S. economy, when large number of individuals are locked in their homes and large numbers of small businesses are shut down for weeks and weeks and months on end, economic activity is going to slow down. There's no question about that. And so it should come as no surprise that the second quarter of 2020 was one of the worst economic times in our, certainly in the most recent past of the U.S. And so I'm not at all surprised by the numbers. And what I would tell you, and I think, and I actually spoke to a national reporter earlier today that was asking about that, particularly as it relates to the election. And so to me, the question that every American has to ask themselves is, do we want to vote for someone in November? Because let's keep in mind that this entire economic calamity that occurred in the second quarter in the U.S. was not a result of bad public policy. It was a result of the China virus being unleashed upon the world. And so what every American's got to ask themselves when they go vote in November is, would I rather elect a leader that led us to 2017, 18, and 2019, one of the greatest economic recoveries in American history, or would I like to go back to the economic policies of Obama and Biden, in which we had the slowest economic recovery on record in the history of America? And I think that's a fairly easy question to answer, and I think it's a fairly easy answer. Yes.
Emily with Associated Press has a question.
Governor, several members of the American Legislative Exchange Council, including Mississippi House Speaker Philip Gunn, have signed an open letter to Congress saying that they do not want Congress to give money to the states as sort of bailout or extra recovery money because of the pandemic. What is your position on this?
I haven't seen the letter that Speaker Gunn has signed. I will tell you that I am, and I'm sure the Speaker is as well, I'm exceptionally concerned about the long-term financial damage that the Congress could do, and in large part already has done. The Congress has spent $3 trillion over the last 3 or 4 months with respect to the pandemic. And so, as you know, the Democrats in the House have asked for $3 trillion more. Those are numbers that are just mind-boggling to me. And in effect, it's the U.S. is, whatever they spend, the U.S. is borrowing that money from China to actually fund the government of the U.S. And so I'm very concerned by it. I hadn't seen the specifics in their letter, but my guess is the Speaker and I are, and the members of ALEC are very similarly aligned in terms of great concern for the financial future of America.
It's been a while since we've talked about this, but what are we seeing in the way of anything with like a nursing shortage? Are we seeing anything COVID specific that is contributing to a further shortage than what we already had, whether it be exhaustion or leaving for other states that maybe are offering more money or whatever the case may be?
Yeah. I'll speak anecdotally, and Dr. Byers may have specifics, but what I would suggest to you is treating COVID patients. I've never personally done it, not qualified to do it, but listening to those who have is an extremely challenging and exhausting process. And so from an anecdotal standpoint, there's no doubt that there are those who have done it for weeks and months on end that certainly are seeking an opportunity to still work, but treat patients maybe that are not quite as difficult to treat. I don't think we have a major shortage, but we certainly have challenges.
Yeah, you know, staffing has always been a challenge. That's not new, and certainly, you know, with the pandemic that we're experiencing right now, there are many different aspects of things that are magnified that actually make it look like they're worse. We know that, you know, hospitals are developing additional capacity in the way of ventilators, ICU rooms, but you know, there's always staffing issues, and you've got to get the right staffing and the right expertise, and it does take, and it is an intensive effort to treat and manage COVID-19. So, you know, that again, that's not a new scenario, though.
Any other questions? Seeing none, I want to thank everyone for being here today. I want to thank all of our partners in state government and in the federal government, in local governments. The only way we're going to get through this is if we work together, if we stay away from politics and focus on what's best for Mississippians. And I'm convinced that that's exactly what the vast majority of my constituents want to do. So to all of you, Mississippi, stay safe and God bless.